G protein-linked receptors are cell surface proteins that transmit signals inside the cell using helper proteins called G proteins. These G proteins are classified by letters like Q, S, or I and control different actions depending on the receptor. A1 adrenergic receptor is a type of G protein-coupled receptor that uses the Q class of G proteins. When it is activated, for example by norepinephrine, it causes the following effects. Tightens blood vessels, called vascular smooth muscle contraction, which increases blood pressure. Makes the pupil enlarge, called mydriasis, by contracting the dilator muscle in the eye. Tightens the muscles that close the bladder and intestines, sphincters, which helps prevent urination and bowel movements. USMLE style question 1. A 55-year-old man receives a nasal decongestant containing phenylephrine. Which of the following best describes the primary mechanism of action of this drug? A. Activation of beta-2 adrenergic receptors causing bronchodilation. B. Inhibition of muscarinic receptors leading to dry secretions. C. Stimulation of alpha-1 adrenergic receptors causing vasoconstriction. D. Blockade of dopamine receptors in the chemoreceptor trigger zone. E. Inhibition of norepinephrine reuptake at sympathetic nerve terminals. Correct answer, C. Stimulation of alpha-1 adrenergic receptors causing vasoconstriction. Explanation. Phenylephrine is an alpha-1 adrenergic receptor agonist. Activation of these receptors in nasal mucosal blood vessels causes vasoconstriction, which reduces swelling and congestion. A is incorrect because beta-2 activation causes bronchodilation, not vasoconstriction. B is incorrect because that's the mechanism of anticholinergics, not alpha-1 agonists. D is incorrect. Dopamine blockade is relevant for nausea and antipsychotics. E is incorrect. This describes drugs like cocaine or tricyclic antidepressants. USMLE style question 2. A patient with benign prostatic hyperplasia is treated with tamsulosin. Which of the following best describes the drug's mechanism? A. Blocks alpha-1 receptors, relaxing smooth muscle in the bladder neck. B. Stimulates B2 receptors, increasing detrusor muscle activity. C. Inhibits acetylcholine at nicotinic receptors D. Stimulates ALF2 receptors, reducing sympathetic outflow. E. Blocks dopamine receptors in the basal ganglia. Correct answer. A. Blocks alpha-1 receptors, relaxing smooth muscle in the bladder neck. Explanation. Tamsulosin is an AL1 adrenergic receptor blocker. Blocking AL1 receptors causes relaxation of smooth muscle in the prostate and bladder neck, making urination easier for men with prostate enlargement. B is incorrect because beta-2 activation causes muscle relaxation, not increased bladder contraction. C is incorrect because nicotinic receptors are related to neuromuscular junctions, not bladder control. D is incorrect because alpha-92 receptors are involved in feedback inhibition of norepinephrine release. E is incorrect because dopamine blockade in the basal ganglia is used for antipsychotic effects.